Afternoon, everyone. First and foremost, I would like to express my gratitude to all of you for joining us today. Whether you're attending from the comforts of your home or taking a break from your hectic work schedule to be here with us today, we sincerely appreciate your presence. Before we commence today's webinar, I would like to take a somber moment to address a deep loss that our community has recently experienced. On behalf of FIP's leadership and team, we mourn the passing of our president and valued colleague, Mr. Dominic Jordan, who left us on the 19th of August this year. Mr. Jordan was more than just a leader. He was an unwavering advocate for our pharmacy profession, embodying the passion and dedication of a true pharmacist. Beyond his professional accolades, he was a cherished friend to many of us, leaving an indelible mark on our hearts. Let us pause now and together pay our respects to Mr. Dominic Jordan. I invite everyone to join in a minute of silence. Thank you. My name is Ozge and I'm a pharmacist based in Turkey. I serve as Education and Professional Development Manager. My primary responsibility is to lead and support regarding pharmacy and pharmaceutical sciences education work. Before we begin, a few housekeeping notes. There will be a dedicated Q&A session at the end of all presentations. Kindly hold on to that questions, then write them or drop them in the chat box and we will address them in turn. We aim to wrap up today's discussion by 3 p.m., respecting everyone's time and commitments. Also, we kindly ask you to write to chat box to write where you're coming from. Also, if you would like to become a member, you can use the website on our link, in the link. And also, this webinar is being live streamed on Facebook, and you're welcome to watch it afterwards on our events page. Our objective today is to delve deep into a topic that is not just relevant, but absolutely vital: the role and impact of vaccinations for older adults. I'm thrilled to share that we have a distinguished panel of experts with us. Jane Barratt will enlighten with us with an overview of the global vaccination environment, drawing particular attention to healthy aging. Peter Guthrie will then share his insights on the vaccination services tailored for older adults in Australia. And finally, last but not least, Suzete Costa will provide us with a comprehensive understanding of the policy aspects employed in Europe. And with that said, now I would like to hand over to my dear colleague, Dalia Bajis, who is the FIP lead for provision and partnerships. Dalia, the floor is yours.
Thank you so much, Ozge, for the kind introduction, and welcome to all of our speakers and all of the attendees in the audience. Ozge, I think there's a bit of a lag with your slide transition, so I'm happy to support you with this. If you would kindly maybe stop sharing, and I will start sharing from my side, just to make sure that we have smooth transition.
Oh, sorry, you don't see my slides?
I do, but they are coming and going out of presenter mode.
All right, after the learning presentation, learning objectives, I will stop sharing and you can take over if that's
okay.
Right.
Could you please put the learning objective slide on the screen, because I don't see it at the moment.
Oh, it's a problem. It's on the screen, so I'll stop sharing right now so that you can take over if that's possible.
Yeah, if you just stop sharing and I'll take over. No problem. Okay.
Done.
Okay. Thank you so much. Can you see my screen okay?
Absolutely.
Great. Thanks, Ozge. That's all right. It's a bit of tech issues there, but we can always resolve it working in a team. Welcome again, everyone. My name is Dalia Bajis at FIP. I'm the lead for provision and partnerships, and I'm delighted to be supporting this session as a moderator. The overall learning objectives for today, we are hoping that you will join us on this journey to find out more and learn more about the importance of vaccination in older adults. And we are accompanied today by an esteemed set of speakers that will really enlighten you with this knowledge. And we are hoping that you will be able to gain some new insights into how pharmacists can help in the identification of people who present particular risk factors or healthy or unhealthy lifestyles, to be able to provide them with educational and counselling activities on the benefits of vaccination, as well as appreciate the crucial role pharmacists play in vaccination and healthy aging of the 50+ population, addressing specific infections such as flu, the COVID-19 and pneumonia. In addition, discover the diverse strategies and resources used by pharmacists to ensure all the adults remain informed and confident in their vaccination choices, emphasizing the broader health benefits. So without any further ado, I'd like to welcome our first and esteemed guest speaker for today, our colleague Jane Barratt, who will be speaking about the healthy aging and the vaccination imperatives. Welcome, Jane. The floor is yours. Thank you for being with us today.
Thank you very much, Dalia. Can you hear me okay?
I can. Yes, Jane.
Good. Look, it's a great honour to be with you this morning. Good morning, good afternoon and good evening, wherever you are around the world. And before I start, I also want to acknowledge the tremendous leadership of Mr. Dominic Jordan. Not only his leadership, but the way that he went about it. I had the great pleasure of meeting Dominic a number of times, and you know, at the heart of who he was and what he did was bringing together across sectors and across disciplines. So it's so appropriate that we acknowledge him today and into the future. Thank you. Next slide, please. So the learning objectives for the presentation that I will be giving is really about the concept of healthy aging. What is it? Why do we believe that it's so important for pharmacists to know this? And what's your job? And also the global perspectives on the importance of vaccination in older adults. Next. Next, please. I think we have to step back a little bit, because way before COVID-19, was in the midst, we knew that the 10 global threats that were identified by WHO to our global health really had a lot of relationship with infectious diseases. And being a pharmacist, you're at the front line of consumers and systems around infectious diseases and treatments. So it's important to recognise that well before COVID, we were acknowledging that pandemic, but also vaccine hesitancy, the importance of primary healthcare, etc., were really part of those global threats that we needed to address. And many of them, we were really exposed. In the midst of the pandemic, we really understood that our healthcare systems weren't working in a streamlined fashion, and also there was disconnects between primary, tertiary, and post-healthcare. Next. Next, please. Look, there are a number of demographic upheavals. These are external drivers that really not only shape our health systems, but the responses that we need to create. So population aging is only one of them. But alongside that, urbanisation, the proportion of people that are moving from rural to urban settings really impacts our ability to respond to their needs. Globalisation and, of course, migration. With natural and man-made disasters, we see many millions of people, moving across the globe. Thank you. The decade of healthy aging, has some certain and uncertain health challenges. Decade of healthy aging is 2021 to 2030. And the uncertain health challenges, climate change, infectious and non-infectious diseases, drug-resistant microbes. But the certain challenges that we know are population aging and an increased prevalence of chronic comorbid conditions. Next, please. Thank you. Next. Just to take us back to what in 1948, WHO defined health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. That really has changed over time as we really understood, the impact of not only health and well-being, but mortality and morbidity. Next, please. So healthy aging, according to WHO, 2015, the Aging and Health Report, the first evidence-based report on aging and health, said it is a process of developing and maintaining functional ability that enables well-being into older age. So I want to highlight that it is a process and it's about developing and maintaining function. And so when we talk about vaccination and vaccines, it's really to maintain and improve our functional ability and our productivity. Next. So this slide really depicts the interrelationship between a number of intergovernmental agendas. And as an advocate for older people, I can say that ageism is one of the barriers through which we must look at the uptake rate of vaccination. We look at immunisation across the life course, so we must take into consideration from birth all the way through to death. The rights of older people in long-term care facilities are exactly the same as the rights of a child. And so we need to make sure that our policies and practices and your practices at the front line really respond to the unique needs of every population group, including older people. Next, please. This framework really talks about the relationship between the UN decade, the WHO Immunisation Agenda 2030, the UN Sustainable Development Goals, and also a document that's come out from WHO, Integrated Care of Older People. The guidelines within that, are being reviewed now, and I'm very pleased to let you know that vaccination will be in those guidelines alongside mobility and vision and hearing care. So vaccination is talked much more about in the context of older populations. Thank you. When we talk about a life course approach to health, as I've mentioned, we talk about functional ability and intrinsic capacity. Intrinsic capacity is all of the physical, social, psychological, and emotional aspects of our life. But we can see that the trajectories change over time from birth through to early and later childhood and adolescent, youth and adult, and then in older adulthood. Next, please. When we talk about functional ability, it's the person within the environment. So it's the interrelationship between functional ability of a person and the environment that gives rise to healthy aging. And so for an older person living in a rural and remote area, their environment impacts their ability to access health services. And that's why community pharmacies are so vitally important for people of all ages, but the environment gives rise to their ability to be able to converse, to discuss their health needs. Next, please. This is a very important slide because, in the latter half of life, there are usually a number of different trajectories that older people could go through. One is a high stable capacity, and you can see that over time, that capacity gradually diminishes. But then you've got those people that have a declining capacity, and that could be because they have several chronic comorbid conditions, and over time there'll be complications such as diabetes, peripheral neuropathy, diabetic retinopathy. So you can see that they have a declining capacity. And then in the latter, the third box is significant loss of capacity. And that could be somebody, that has been independent for quite some time, but the diagnosis of a brain tumor would mean that they have a significant loss of capacity, rapidly. What we're trying to depict here is in every part of these trajectories, there's an opportunity to improve functional ability and improve intrinsic capacity. And one of the aspects is one of the most effective public health interventions, and that's vaccination. Older people and those with chronic comorbid conditions, diabetes, lung conditions, etc. Next. These two slides, talk about the different trajectories, but I'd like you to focus on the trajectories of physical activities. What we know is that, a person that has influenza in their older age with chronic comorbidities that is hospitalised, their return home, they will have moved from independent and high capacity all the way through to a significant loss of capacity. So, an older person with an infectious disease never returns to the original functional ability. And so we talk about the number of people that are dying from infectious diseases. We should also be talking about the number of people that have a significant functional decline and the impact and burden on the healthcare system. Next, please. This is just to remind us all that we need to create knowledge, to have the evidence, to then advocate. And in our job, it's to influence policy. And in doing that, who do we communicate and how do we communicate? Next. I'm going to give you two examples of our work. And I want to acknowledge Gonzalo Sousa Pinto, who I know was one of the leading lights in your organisation in the development of, the FIT toolkit. Well, the IFA has a toolkit that focuses on policies. So expanding those who can vaccinate, such as pharmacists, seamlessly improving the pathways, prevention, the education and the information that you disseminate. How do you disseminate it? Do you take into consideration different levels of health literacy? And of course, equity. Next, please. And finally, the IFA, oddly enough, being an organisation of those who advocate for older people, have now created, a World Coalition on Adult Vaccination, which brings together experts across sectors and across disciplines. And that's one of our vehicles to actually disseminate information, but bring into, a point of contact. Next, please. Any questions? Thank you. That was very quick, Dalia, but I hope that gave you a bit of a glimpse of vaccination in the context of healthy ageing.
That was super, Jane. Thanks a million for your time and your lovely presentation, which was very well received. Thanks a million for this. As I can't see the Q&A box, my colleague Ozge is supporting me with this. And if there are no questions specifically for Jane, Ozge, I have just one small question or comment for Jane about the importance of the partnership that FIP has with the International Federation of Aging. Your comments on that, Jane, would be really appreciated for our audience to learn about this partnership.
Look, the International Federation on Aging cannot and does not do anything by itself. But I can earnestly say, Dalia, that the relationship and partnership with FIP has been fundamental to our understanding about how we can support older people. Not only have we worked on policy toolkits, etc., but it's really this interrelationship with, one of the most trusted sources of information to older people. And time again, we hear from our constituents, of which there are about 75 million around the world, that they go to their pharmacists because they can talk to them. And the pharmacists are trusted and provide accurate sources of information. So may our relationship grow stronger and be more powerful in the future. We can't do anything by ourselves, and we welcome the partnership with FIP.
Thank you, Jane. Can't echo those words more. And in late Mr. Jordan's words, in solidarity, trust, and action, we do this together. Thank you so much, Jane.
Pleasure.
We have a question
for Jane, Ozge? Yeah.
Yes, in the Q&A box, and I'm sure other participants are now reflecting the beautiful information that Jane has just given to them. We have one question in the Q&A box from Elon, and he says, are older pharmacists more or less likely to get on the wagon?
Sorry, Ozge, what was that question?
I think that Elon is asking if older pharmacists are more focused on giving more information about the healthy aging than compared to younger pharmacists.
Oh, likely to get on the wagon. I would like to take age out of it. It's not about older pharmacists or younger pharmacists. You have a responsibility, just the same as we have a responsibility, to talk about the health and well-being of your consumers. And one aspect of it is really how do we develop and maintain our functional ability. So I'd like to take the word older out. Everybody at all ages in your community has a tremendous responsibility to share the information that you have. And that's why education sessions such as this are so important.
Thank you so much, Jane. Thanks, Ozge, for fielding those questions for us. And we'll let Jane sit on the side for now and maybe join us for the panel discussion later on if time permits for her. I'd like to move us to our next speaker, who will introduce himself, our dear colleague, Peter Guthrie from Australia. Peter, the floor is yours to self-introduce and run through with your presentation. Thanks a million.
Thank you. And I would also like to acknowledge the passing of Dominic Jordan as FIP's president. His loss will be felt across the organisation and to all of those whose work he touched. So I'm very happy to join in the acknowledgement of Dominic's contribution tonight. It's been a sad couple of weeks for the FIP family. I also am quite humbled to be part of this panel after really Jane's excellent presentation in outlining some of the big challenges that countries with ageing populations and everyone wants to live really good lives as they get older. And particularly in countries, I think Australia is a really good example of that, where our population is getting older as their average age. And I'll go through a bit of that in some of the background and context. But people do have higher expectations than perhaps their parents and their grandparents did on having a really good quality of life. As they get older in their retirement and for a longer period after that. They want a life not limited by illness, and they want a life where they can help protect those around them. And I think Jane's presentation really set the scene really well for that. My name's Peter Guthrie. I'm a pharmacist here in Australia. I'm based in Melbourne, which is in Victoria, and I have a couple of different roles. One of those roles is with the Pharmaceutical Society of Australia. That's our national pharmacist body. We represent all 36,000 pharmacists in Australia and their professional interests. And I have a role on the strategic policy team. And I also have a role with the international engagement angle, which is part of my engagement with FIP, which has been formalised. I'm also a community pharmacist working in an after hours role in a community pharmacy. And in that role, I've been a pharmacist immuniser probably for about 5 or 6 years in the immunising capacity. Immunising for pharmacists started in Australia about 2015. We're going to talk about a few different things tonight or this morning, depending where you are. It's definitely nighttime here. The first of those is I'll talk a little bit about where Australia's at with vaccination and older people, and then that will talk a bit about what pharmacists are currently doing and we'll be able to do more of in the future to help. We'll talk through some of the factors that are a really good indicator of vaccine uptake by both health professionals and individuals, and how we can use that framework to really build immunity within the community and increase protection through wider reach of vaccination, and then talk a little bit also about sort of what that looks like for patients and for pharmacists. But context is quite important, and the next slide talks a little bit about Australia specifically. We're a country, a very large country in size, but a population of only 25 million individual people. 25% of the population of Australia was born overseas. 50% of people who live in Australia have a parent that was born overseas. And we also have 1 to 2% of the Australian population are First Nations people. That's our Aboriginal and Torres Strait Islander population. the world's longest continually surviving culture of over 60,000 years. And each of those demographics and population makeup affects how we, as health professionals, support our population's health. I would also like to acknowledge that I'm coming to you tonight from Wurundjeri land in Melbourne, and would like to acknowledge any Aboriginal and Torres Strait Islander people on the call with us this evening. And then I think the other factor about Australia is that our population is very much based on the eastern seaboard. If you sort of take this, so our eastern 3 states and part of South Australia, 80% of the population rests there, and the rest of the country makes up about 80% of the land mass, has about 20% of our population. This slide also describes the fact, and I've mentioned states a little bit already, like many countries in the world, we have multiple tiers of government, and different tiers of government deal with different aspects of our health system. So our federal or national government, we have a regulatory body, the Therapeutic Goods Administration. They register the vaccines. They deal with the registration and sharing of information for that. The federal government is responsible for the funding of primary care and effectively forms the role of a single payer in Australia. So primary care, we have a Medicare system where people can access health services through Medicare, through their doctor, or through the Costa medicines for their pharmacy, through the pharmaceutical benefit scheme. That is through effectively a single payer model that does have some co-payments. There is a much smaller role for private health insurance in Australia. And our federal government also operates our National Immunisation Register and electronic health records. And some of those structures have been really important. Our National Immunisation Register is now a mandatory place to record all of the vaccine events that occur in Australia. For the vast majority, they get uploaded within sort of 10 minutes to 24 hours. And so increasingly becoming a cradle to grave record of someone's vaccine history. They also operate electronic health records, and they also coordinate Australia's vaccine policy through an expert advisory group, which is made up of vaccine experts and a whole range of really important voices. And probably most Australians hadn't heard of those until the pandemic started, and we heard a lot about their work. The Commonwealth also supports the vaccine providers like pharmacists and general practitioners through various support programs they run through what they call primary health networks. They're like local networks that go out and provide support. Our state governments, however, have the responsibility for health in terms of the legal framework that we work under. So they regulate our health services, and that includes our medicines and our poisons laws. They are responsible for the operation of public hospitals and the funding of those hospitals, but also the regulation of practice that occurs within them. And they also distribute government-funded vaccines on behalf of the Commonwealth. And that sort of comes into a bit of our discussions tonight. And in terms of our vaccinated workforce in Australia, we have pharmacists, nurses, and medical practitioners. Nurses and pharmacists require additional qualifications, whereas medical practitioners, that's part of their early scope. And we've had a lot of success, I guess, through the COVID-19 pandemic in demonstrating a wider vaccination workforce. This slide really shows that once there was enough vaccines available, community pharmacists, and this is a graph of all the vaccines delivered by community pharmacists in Australia, that community pharmacy really provided a huge booster to the rate of vaccines that were able to be delivered. And then as we moved out of the sort of acute phase of the pandemic in late 2021 and other providers scaled back our government vaccination hubs and GPs returned to their normal work, community pharmacists have taken on the lion's share of the vaccination effort in terms of the various booster doses that have been recommended. And we now have community pharmacists administering over half the vaccines for COVID-19 doses in Australia at the moment. And the next slide just has a lovely hero shot showing that that's over 11 million doses, and from 36,000 pharmacists in the country, we think probably about half to maybe a bit more might be trained and authorised to administer COVID-19 vaccines. That's a really outstanding achievement. But the photo also demonstrates that part of that work has come through outreach work, where pharmacists have gone into aged care homes to administer vaccines, into disability care facilities, and conducting home visits. And those are really important things to be able to continue doing if we're looking at supporting older people through vaccination into the future, because what worked really well in the pandemic is we looked really closely at all those things that make it easy to be vaccinated. And when we talk about the 5A model in a sec, that will become quite important. We did very, very well with in aged care early on. We haven't done so well with the boosters with aged care. But I think this graph's a really interesting one to show opportunities for pharmacists playing a greater role. This graph shows all influenza vaccines administered in Australia over the past 4 years. It's an equivalent at the end of July, which is the kind of the middle of our winter, which is by that stage, most people who've going to get an influenza vaccine will have received it. And the little blue bits at the top represent the number of doses administered by a community pharmacist in a community pharmacy. And the grey and the dark grey is doctors, and the light grey is others, such as nurses that might run nurse clinics. What's really notable about this is we've gone from around 15% of vaccines for influenza being administered in a community pharmacy prior to that national rollout of the COVID-19 vaccine to nearly sort of a quarter now. And that's really sort of a 60 or 70% increase in the percentage contribution, reflecting a very strong acceptance of the role community pharmacies now play. There were some other levers in there which helped with that. But we start from a very high rate of success in Australia with, say, influenza vaccine in older people. For people over the age of 65, they have access to a free influenza vaccine every year. Traditionally, they would have got that from their doctor. Increasingly, there's a choice of providers now. Over 80% of people in that age bracket currently receive an influenza vaccine most years. So even though the raw numbers you'll see in the total population in Australia jumps around a little bit each year, that variation is predominantly seen in people under the age of 65. People over the age of 65 are very, very good at going and getting access to the influenza vaccine. The next slide then shows, well, what can pharmacists do? And don't get overwhelmed by the slide. It's mainly to create visual impact. These are all the vaccines that we currently have in the Australian Immunisation Handbook along the top, and then all the states and territories down the bottom. As I said, every state and territory has different regulations that apply to what you can and can't do. And there is state variations. I practice in Victoria, so I'm able to administer vaccines, say, for pneumococcal to people over the age of 50, but my colleagues in Western Australia, the cell under that, cannot at this point in time. The green represents the minimum age. So if there's a number there, that's the minimum age to which a pharmacist could administer a vaccine. If it's a tick, it's to all eligible ages. But what the next slide does, and I've tried to pare this back a little bit, is it demonstrates these are the vaccines that are routine recommendations for people who are over the age, say, of 50 or 55, 60 years. And so you see influenza, pertussis every 10 years for a large part of that cohort, COVID-19, pneumococcal, herpes zoster. Those are the vaccines that most pharmacists in most jurisdictions currently have the authority to initiate and administer that vaccine. So that provides us with some really great opportunities. I've left some other ones there on white backgrounds. They reflect vaccines that perhaps aren't routinely recommended because of an age group, but they may be recommended to people who are older because of other aspects of their lives. So whether it's if you're living with immunocompromised people, there might be a vaccine recommendation there, or in the case of Japanese encephalitis, we've seen that now become potentially an endemic disease in parts of rural Australia, and there are now recommendations if you live in rural Australia and spend time outside, such as an older person who does gardening, that's now becoming a routine recommendation for that population group as well. So what I think the takeaway for that graph slide is that there's of all the vaccines that people over the age, older Australians might need access to, pharmacists have the authority to authorise and administer most of them in most states, and we'll see more of those get coloured in shortly. The 5 A's of improving vaccine uptake, and we'll just go back to the slide with the 5 A's and the heading perfect. This was something that was developed in 2016. It was a study that was done that looked at how do we know what vaccines, or how do we know what improves vaccine uptake, and how do we categorise that? And it looked about 43 odd different studies from around the world and established 5 very clear domains, which all happen to start with the letter A, as they sometimes do in research projects, to look at what are the predictors of vaccine uptake. And they were really clear in the end. So access, affordability, awareness, acceptance, and activation. And I'll just take a couple of minutes to go through each of these. Vaccine uptake from an access point of view, if your workplace recommends it or your university or school recommends it, that's going to make it more likely for you to take up the vaccine. When they looked at older people who may not be working anymore, what they actually found is that people who had really frequent contact with their healthcare team had a higher vaccination rate than people who had infrequent access with their healthcare team. And people who had a chronic disease is probably a really good predictor of influenza vaccination. So that's probably partly their engagement with their doctors and other part of the healthcare team. It also provides an opportunity for community pharmacists who will see their older patients perhaps every month, perhaps every 2 months in relation to accessing medicines. Convenience is also very important. Affordability, they specifically looked at the impact. I think there was an American study that said, what happens if you gave out vouchers for free vaccines? Well, they did this in elderly patients and found a really high uptake of vaccination. And we've also seen that in Australia through the National Immunisation Program, where people who have access to free government-funded vaccines are much more likely to take it up than those that do not. And the activation, so the degree of providing structured reminders, whether that's a text message service or whether that's something else. So we think about those 5 A's. The next slide sort of talks about some of Australia's strategies for trying to do those. So we have both our general practice network, but we also have a community pharmacy network that is able to help improve access. And the barrier to that being really more widely taken up has been previously our access to government-funded vaccines. And from the first of, and our ability to have the administration fee to administer the vaccine, the professional service, being paid for. So from the 1st of January next year, the Australian government has announced that people will be able to get any NIP vaccine that a pharmacist is legally able to administer, that they'll be able to get that at a community pharmacy. They'll be able to receive that free of charge, and the pharmacist will receive a payment of 19 Australian dollars. So that's sort of about 12, 11 euros for that professional service. So the vaccine is free of charge, and the consultation fee has been met by the government. And we think that's going to be really important in improving uptake. Awareness is also very important. So the strategies to increase awareness are really about focusing on communicating a personal benefit and discussing the vaccine schedule with the individual. I'll talk about how we might do that with an individual in just a second. Acceptance, so the strongest predictor of vaccine uptake is a strong and clear, unambiguous recommendation from a healthcare professional that's based on that individual's needs, not general needs, but that person's particular needs. And the activation, so those prompts and reminders, how do we actually help those occur? So the next slide, I've got 2 potentially quite typical situations. On the right-hand side, we have an image of a pharmacist who is supporting an older person with accessing a regular medicine for a chronic disease. And on the left-hand side, we have a pharmacist who might be doing a medication review in a private room. In this case, this is a pharmacist that is working in a general practice who sees patients to talk about their medicines and other things. In those longer consultations, the way you might bring vaccination up in conversation is you might routinely check the immunisation register as part of that practice and that service that you provide to identify potentially due or overdue vaccines. So that could be during a medicine review, during a multidisciplinary care case conference, or even if someone's come out of hospital recently following an admission, you might look and see what might be missing there. You may have opportunistic vaccination events. The patient may raise the topic with you. Sometimes I work in a pharmacy that has a TV with a news channel on behind us. Sometimes that will prompt conversations about vaccination, and you can sort of have a chat about what vaccinations might benefit the individual. But I think one of the most powerful events where you can sort of engage older people with vaccines that they may not have considered in a vaccination event for something else itself. As I said, 80% of older Australians will receive the influenza vaccine every year. You're required to check the immunisation register before you administer a vaccine. And so that's the perfect opportunity to identify what vaccines might be missing, what are the person's individual needs, and how else can you engage them with vaccination? And then have that conversation about how that then impacts on the quality of life. There is a question about how do you structure those conversations, and we have references. Yep, the next slide. The references in Australia. So there was initially some 2 resources. One was about helping people have conversations with people who are pregnant, and one was about having conversations with parents about childhood vaccine. That's now been combined into a resource called Sharing Knowledge About Immunisation, or SKY. And that resource is maintained by Australia's National Centre for Immunisation, Surveillance and Resources. I've got that acronym terribly wrong. But the resource, which at first glance appears to talk about children, has some really good tips on how you can frame conversations for people who might be hesitant, ready, or who are declining vaccination. So it talks about structuring conversations. So if, for example, someone's hesitant, they talk about eliciting specific information. They talk about setting and maintaining an agenda, how to structure that conversation around that, and give some really good, specifically evidence-based questions on how you can do that in a non-judgmental way, a way that you're not perhaps talking over somebody. So that is a really valuable resource, and it's one that will help structure either a long conversation, or you might take out one or two key questions to structure a shorter conversation as well. So I think my time will beat me shortly, but I think the summary is that there is a huge role for pharmacists to play. We are living in a country that is struggling to meet the health needs of our population in primary care because we have an overload in our general practitioners. So community pharmacy will increasingly become a bigger part of our vaccination workforce, and older Australians make up a big part of that. There is strong public trust in pharmacists in Australia, and that is something that is really important if you're going to be talking about something that people may not self-identify as a health need. And I think the other aspect is that sometimes it's a bit easier to get into a pharmacy than it may be to get to that access angle, where you might need to make an appointment to see a pharmacist for a vaccine, but you can probably get that appointment. Other providers may not be as readily available. We generally have longer trading hours. So I think my last slide, which is a gratuitous, lovely, happy image of a smiling pharmacist with a patient who was very kind to us when we took some photos. The segue here is that this photo was taken in a Brisbane pharmacy in June when I was up there doing a few other things, and I really got quite excited for the FRP Congress, which is happening in a few weeks in Brisbane in September. So I look forward to seeing those of you who are travelling to Australia at the conference, but otherwise looking forward to the rest of this session. Thank you.
Thank you so much, Peter, for that excellent presentation. I'm sure that many will join me in thanking you for how you presented, kind of giving an overview of the structural system in Australia supporting the vaccination campaign and the pharmacist role, but you've also gone down to really the individual responsibility of pharmacists, how they can support patients on a one-on-one basis. I love the examples that you have provided, and I think I'd like just to ask one question that might be on the minds of some of our listeners today who come from different parts of the world, where you would appreciate there are different service levels, there are different scopes of practice, different regulatory systems and frameworks. For somebody that's listening in going, I really would like to make a change in the area of vaccination, where do you think a pharmacist could start? If they're working in a community pharmacy, what could be a starting point for them to encourage vaccination in older adults? And you've mentioned the use of technology. You've mentioned some examples already, but is there something that you want to reflect back to some of our pharmacists coming from different countries that would aspire to do something like this?
I think that question probably touches on the fact that pharmacists don't have the authority to initiate and then administer the vaccine in every country in the world, and that's still the case for some vaccines for us. But pharmacists are medicine experts, and people have a very strong trust in their pharmacists. So even if you're not the person administering the vaccination, if you identify someone that you think would benefit from vaccination, that strong recommendation coming from you, if I were you, I strongly recommend you have this vaccine. You're looking at, say, it's an older person with pneumococcal, you have risk factors for pneumococcal disease. You may recover, but you may not recover as well as you would otherwise do. I strongly recommend you have this vaccine. That's going to make a real impact for that individual patient. And then I also think if you're told taking a step back and you're looking at national organisations, FIP has developed some excellent resources through to support national organisations such as the one that I work for, and helping work with governments to expand the licensing and the role pharmacists can play in different parts of the world. But you don't have to be an immuniser to be an advocate and perform that health promotion role in helping people live a better life in their older years, because we all want to live a good life in our older years. None of us wants to be sick, none of us wants to be unwell, and none of us wants to be on that for that pathway to decline to be faster than it needs to be. And for so many of those conditions that Jane put up in those early slides, they are vaccine preventable.
They are. That's really helpful, Peter. And I also, talking about FIP resources, and we can probably add this to the chat box, Ozge, FIP developed a knowledge and skills reference guide in vaccination. So for individual pharmacists that perhaps want to upskill or gain knowledge about, how to become an immunizer and what kind of knowledge base they need, that's probably a good resource to go to as well. We can put that in the chat. And also, I guess, Peter, becoming an immunizer in a particular country does take time. So it's taken Australia a long time to get to this point. It's similarly with other countries. So it's a journey that we have to start and go through. Ozge, were there any? Sorry, go on. Apologies.
Oh, I was just going to say that there are some enabling aspects. The fact that we have consultation rooms in pharmacies in Australia, many had that to enable us before we could get the vaccination. So in moving forward, it's about moving to a more consultation-based model of care and building our services, whether that's community pharmacy, others, so that when the chance does come for vaccination, we're ready as well.
Yeah, perfect. Thanks for that, Peter. I appreciate it. Is there a special question, Ozge, for Peter in the Q&A?
Oh, definitely. There is one question, but there is, I have one question too. Thank you, Peter, for this informative presentation. I'm sure our participants are just enjoying. I can see the chat box. They are saying it's very good. Regarding your presentation, you have gave us an overview from Australia. So I was wondering, given the unique challenges and opportunities presented by Australia's diverse geography and population distribution, how did the community pharmacists bridge the gap in vaccination coverage, ensuring that both urban centers and remote areas benefited equally from their expertise and services?
It's probably, to answer that question, it's probably a team effort. I think during the COVID-19 rollout in Victoria, for example, the government used that a number of frameworks. The AAA one was one, or 5As was one of them, to identify how to get to those hard to reach populations. So, and pharmacists were a part of that. So in some cases, they paid for pop-up clinics to be at churches or synagogues or other religious locations. For people with disability, they ran clinics in locations that were low sensory. They provided those services. The resourcing into that was incredible. And I think of all the jurisdictions in the world, Victoria had probably the least disparity in terms of which population groups had different levels of vaccination. And there are other measures in there like mandates mixed in as well, but that they really went through every single one of those sort of 22, 23 predictors to find how can we contribute. And what pharmacists were able to do is pharmacists that spoke multiple languages, people felt much more comfortable speaking to a pharmacist that spoke their language. We have a free translation service available in all of our pharmacies as well, through a government hotline in real time. It's really about going, what can we do to improve access? And a pharmacist in a community pharmacy, they know their patients probably better than the government does. But sometimes it's trying to find those patients that you never see. So people with a disability you may never see. And it's about probably also engaging with their carers and their communities to try and get the message out to everyone.
Fantastic stuff. Thanks, Ozge, for that. And if there are any questions directly to Peter, should we save those for our final panel discussion if we have time, Ozge, so we can proceed with our next speaker?
Definitely. And Peter, if you have any time while you are listening to Suzette's presentation, you can just type in the responses that we have in the Q&A box. Thank you.
Thank you so much, Peter, for the lovely and excellent presentation. Thanks a million. We'll be moving on, I think, Ozge, with our next presenter. It gives me great pleasure to present our final speaker for today. And our colleague Suzete Costa from Portugal is welcome on the call. Please introduce yourself and the floor is yours. Thanks a million.
Thank you so much, Dalia. I also would like to take a moment to pay my deepest respect to Mr. Dominique Jourdain, with whom I had the pleasure and the privilege to work even before he became president of FIP, while he was president of Pharmacists. And after that, he was a true remarkable leader. But I'm sure FIP and all of us will do our best to continue his legacy. So that said, I would like to thank FIP for this invitation. So my name is Suzete Costa. I'm a pharmacist from Portugal. I work for the past 4 years at the Institute for Evidence-Based Health, where I'm the executive director and senior research director. We perform studies, and my role is actually in real-world evidence and outcomes research studies. Before that, I spent 20 years at the Portuguese National Association of Pharmacies, where I led the pharmacy services unit and later on the research unit of ANF, responsible for developing services and evaluating them, including the first vaccination, so the first flu vaccination service that my team and we implemented in 2008. So next slide, please. Thank you. So our learning objectives for today, I hope you can gain some insights on the epidemiology of vaccine preventable respiratory diseases, especially in older adults and at-risk patients. And we appreciating the expanded roles of pharmacists in several new areas of vaccination for this subgroup of population, and also discover, or at least remember, some compelling arguments to ensure uptake of vaccination and increase of coverage, so that patients are aware of the vaccination benefits. Next slide, please. So I'll begin by setting the scene very briefly, then go through the target population that we are discussing in this presentation or in this session today, some of the evidence and some of the things we know about pharmacy-based vaccination, and then, of course, close with the benefits and the importance of vaccination literacy and how pharmacists can play an important role. Next, please. So setting the scene, I think there is one slide before that. Can you just go back? Yes, thank you. So, so I think some of the major respiratory disease infections have an impact or a major impact in vulnerable populations. And this includes not only, but includes the older populations. And you can see with this slide, I tried to show you some of that impact in this subgroup. So the death rates in influenza, a respiratory disease, so in flu, in pneumonia, in COVID, and also in the respiratory syncytial virus, they have a huge impact in this particular subgroup. And while we are more familiar with flu, of course, and then COVID, and now pneumococcal vaccination, I also would like to draw your attention to the RSV, because this vaccine has just been approved for the first time by FDA and the European Medicines Agency for the older adults. So I think it is important for FIP and for all of us pharmacists to keep in mind that we also need to develop efforts in involving pharmacists to deliver this vaccine in the next months and years to come, and generate the evidence around this. Next slide, please. So with this setting the scene, I also would like to reflect on a moment, thinking of all the various infections and that are vaccine preventable diseases. We can see there has been a great evolution from thinking of the timeline between the date where the disease was first discovered or first linked to a pathogenical agent, and the discovery of the vaccine. So what this slide shows us is throughout times, and between 1880 to 2020, you can see that the timelines for developing the vaccines have been shrinking. This is remarkable from an innovation perspective and from ensuring a more rapid access to vaccine. And I think we can all see the major effort that has been made in COVID. We all witnessed that we could in 1 year develop a vaccine to mitigate and so the impact of this epidemic. So next vaccine, please. Next slide, please. So with this identifying patients or eligible population, it very much depends and follows the guidelines of each country, of each health authority. And it may vary according to vaccine and according to each country. So there is not a, it's when we speak of older adults, the minimum age may differ from country to country and from vaccine to vaccine. So it's not the same. And it's very important that pharmacists follow to those guidelines so that their efforts are aligned with the national guidelines in doing so. And usually, of course, the most vulnerable populations are the most relevant. Older adults, not just the older adults visiting our pharmacies, but also those in residential care and nursing homes. And then, of course, it is very important, although this session is focused on older adults, we must not forget at-risk populations for certain vaccination, which creates a huge range of opportunities for the population subgroups that pharmacists are able to reach, and not forgetting, and this is very important, they themselves as pharmacists, because it is very important that pharmacists themselves are also included and are part of the movement to vaccinate themselves against seasonal vaccines such as flu, to protect them, to protect the team of the pharmacy and their patients. Next slide, please. When the flu vaccination is, of course, one of the most relevant for when we talk about pharmacy-based vaccination. This is a map of a study published that shows in Europe which countries are now able to provide vaccination, flu vaccination, either through pharmacists or employing other providers. And I just wanted to take a moment to share with you our Portuguese experience. So we learned in 2008, our team went to the United States to learn with American pharmacists who were doing this since the 80s. And so we actually modeled our training and our resources and all our strategy from the US model, the training model, which was accredited, which was and still is accredited by the CDC. And our experience in 2008, when we enrolled pharmacists, that we started from zero, and in 3 months, we reached 48% of community pharmacists all over Portugal being certified, trained and certified to provide vaccination for flu. And this experience and tools were then used by other European countries such as Ireland and Switzerland. Our colleagues have approached us, and later on by FIP when developing the kit for the toolkit for the entire world. So I think this is very important, because it's by country experience and all of us doing that we are also able to share with one another, and also provide our FIP organization with more tools also to spread and actually enhance this this important intervention. Next slide, please. So this was a study my team performed for the pharmaceutical group of the European Union on when we had to assess the interventions provided by European pharmacists on COVID. And so the COVID pandemic has created opportunities for pharmacists to expand many roles, including COVID vaccination in at least 8 countries. By June 2021. So this number is slightly increased now, with more joining later, including my own country, which will provide, where pharmacists will provide COVID vaccination this fall for the very first time. Thank you. Next slide, please. I also wanted to take a moment to share one study I found. There are not many studies on the evidence on pneumococcal vaccination, but pneumococcal vaccination is a very important vaccination in older adults. And it is important that we are also able to engage pharmacists, community pharmacists, in providing this vaccination for older adults. That it has an enormous benefit. Usually it's not an annual vaccine, but it has a huge impact in decreasing the mortality rate, and there is a huge benefit. And this study shows exactly this. So you can see that the intervention group, including pharmacies, there is the patients in this group have higher odds of receiving a pneumococcal vaccination. So nearly twice, if you see the adjusted odds ratio, so 1.91 versus the control group. So this is, then the pharmacies account for a very important variation in this outcome. So this is a message to invest in this group, in this vaccination, but also in providing, in performing research demonstrating the value of pharmacy vaccination in pneumococcal vaccination. It's not just all about flu or about COVID. Thank you. Next slide, please. Next, my last point is talking about the compelling arguments for pharmacists to be advocates for providing trustful information on vaccines to patients, because there is an issue of mistrust in many people and in many countries, and even in jurisdictions with advanced economies. And so there is an important role pharmacists have to play with compelling arguments. I find this slide very powerful, because what you can see is the impact of vaccines when they're first introduced in several areas on death rates. So you can see clearly in many of these infection diseases, the decline on mortality when vaccines were introduced. This is a huge compelling argument to convince not just pharmacists themselves, but also the patients they counsel. Thank you. Next slide, please. So then the vaccination health benefits, it's not just about death rates, and it's not just about protecting the individual health. And this is also a very important argument. I think it's important pharmacists are aware of. There is a collective social benefit in high vaccination coverage due to herd immunity. So it's not just about individual health protection. So when you vaccinate, you're not just protecting that particular individual, but when you do reach a certain number of people and that get immune against the disease, when that number is reached, such as the disease no longer persists in the population, then you reach herd immunity. Of course, herd immunity is very different from vaccine to vaccine. So it is important to say that it's not the same for every vaccine. There are deadly diseases that require a very high number of population to be vaccinated. You know that, and respiratory diseases require a lower number, but still the message here is the important effect conferred to the community as herd immunity sometimes may not be reached, but we have to do our best efforts to increase. And I think this is also a compelling argument for pharmacists to use. Next slide, please. Then also there is a problem of mistrust in vaccines. We all know that. So in this slide, what you can see on the left slide is the share of people, of respondents in a very important study performed worldwide on the safety of vaccines. So you see there is an issue in countries colored in darker colors, dark blue colors. There is an issue, people not trusting the safety of vaccines. So vaccines are highly safe. We all know that. Or at least we should know that. And there is a huge problem in some jurisdictions in terms of trusting safety of vaccines. But it's not just about safety. There is also an issue of trusting that vaccines are actually effective. On the right hand of your slide, you can see that in pink, in dark pink, the countries that have most issues in trusting vaccines. And this is very relevant because it's an area where pharmacists can also provide trustful and reliable information based on science and not on beliefs, so that we can really educate people and increase coverage in vaccination. So next, my closing slide, please. So in a nutshell, what I wanted to say is that the role of pharmacists that can play is in vaccination, of course, but then as we've seen in providing reliable and trustful information on vaccines. And last but not least, very important, and although vaccines are safe, as we have stated, pharmacists have an obligation, being the experts on medication, of reporting adverse events, and we would like to see pharmacists reporting adverse events, not only for vaccines, but for any other medicines, to their national health authorities. Thank you so much.
Suzete, thank you so much for that enlightening presentation. Really, really enjoyed learning about the compelling evidence on the benefits of vaccines in not just all the adults, but in various populations and subpopulations, as you described it, Suzete. I'd like to make a small suggestion, Ozge, that perhaps we can stop sharing slides and go on screen, along with Peter as well, and direct any questions to Suzete, but also kind of have a bit of a panel discussion. Is that okay with everyone? I'll just stop sharing, and I can see Peter's already joined us. Great. And we've got Suzete here. We have apologies from Jane. Ozge, do we have any specific questions to Suzete to start off with?
We do, but it's very focused. I'm not sure if the right time to ask, but we have a question from Atola. So his question is about newly generate anti-cancer drug, which is atezolizumab, that effective in some cancers by enhanced immune system with patients. So is that true? Suzete, do you have any information regarding this drug and its effect with vaccination? Do you have any comments on it?
Apologies, I'm not familiar with this with the effects in vaccination of this particular medication. What I do know is that patients with cancer and usually undergoing chemotherapy, radiotherapy, and biologics, as I think it's the case, it's a biologic medicine, they have their immune system compromised. So it's very relevant that they also are major candidates for certain vaccines, as long as they're not contraindicated for them. And usually flu and COVID vaccines are actually indicated for this particular subgroup of patients. Just because of that, because their immune system is compromised, and it's a way of protecting this particular group of patients.
Thank you. Thank you so much. Also, we had a question from Ilan, which has been answered by Peter on chat on Q&A box. And Ilan asked about the data about the Australians getting the flu vaccines, and how many are them are seniors, and how many pharmacists are using this to get this number. And Peter, do you have any additional comments? I saw that you gave a comprehensive response, but perhaps our participant who hasn't been able to read that comment, maybe would you like to say something as well?
I think one of the takeouts is that the provision of data through our National Immunisation Register is so valuable, and some of those support organisations that I mentioned in my presentation, their role is to get much more customised reports at a local level. It might be a town or a doctor's patients to report who hasn't accessed vaccination, and that's been part of the success story in Australia on how medical centres and general practices have been able to bring their patients in when vaccines like influenza vaccines have arrived, which is why we generally have very good rates of vaccination against the influenza. I think pneumococcal is not quite as good. We'd probably like to see some of those other vaccines that I mentioned in my presentation get a bit higher. But it's through the provision of those reports to practitioners and ways to then recall and remind patients that are so valuable and have been able to support vaccination. And we have that for vaccination. I'm often very jealous of some of the Nordic states. They have that for registers for all sorts of conditions beyond vaccination, and whether it's a single payer system or, as we see in countries like America, where health funds use that sort of end-to-end data, data drives good outcomes when you use it well.
Thanks. You, Peter. Dalia, do you have any additional questions for our beautiful, informative experts?
I have a question that comes to mind as I was listening to your presentation, Suzete, about the compelling evidence and all this amazing data about the benefits of vaccines in older adults. And I wondered, as a previous community pharmacist myself, how this information can perhaps be relayed to our older adult populations in patient-facing settings, whether you're in community or hospital pharmacy, in kind of like simple but understandable ways, so they can appreciate the importance of getting their vaccines, being on top of it all. In your opinion, and I know Peter will probably be able to comment on this because he works in community pharmacy, how you're able to relay this information in a simple and understandable way, but maybe what is also the role of technology here with older adults, and do you have experience with using technology that supports them to keep track of their vaccination, for example, or to encourage them with information and knowledge? I'll start with Suzete first. Thanks.
Okay, that's a very good question and challenging one. Yes, because it's an older population, so there is here there are some struggles how to get the message across in their language so that the patients and this older population can understand the benefits, because this is all about concepts like herd immunity. I know they're very difficult to explain to lay people let alone the older population. My suggestion would be, of course, there is material from your own national authorities in certain countries, but also very good ones from the WHO and the CDC. And I particularly am very fond of the materials of CDC because they're not very paternalistic, but it very much depends on the country. You know, I don't think there is a one size fits all solution, because in some countries the literacy level of the older population may be so low that you probably need to explain to people, and you do have to use a more, let's say, I won't say paternalistic, but it has to be explained in a more simple way, rather than versus comparing other jurisdictions where people are more demanding. They're not at that level anymore. So you need to give them facts and you need to give them some evidence. So it has to be tailored to the population. But again, trying to use the backup information provided by experts, developing some material in WHO or in CDC about the benefits of vaccines in this particular areas, the herd immunity concept, which is it's kind of a solidarity compromise of the community. It's not just about the individual protection, it's the community, and the importance of reaching a herd immunity effect or being close to that goal. Regarding technology in my own country, yes, there was not much support in the first years from the government in terms of including pharmacies in the system. But that has changed now in recent couple of years. Pharmacies now have access to the immunization record, and they're able, and in fact, they have a compromise to actually record that the vaccine has been provided in the immunization record, so that it's all kept in one file, which is very good. It's important because it feeds also the system. It's a way of demonstrating the contribution of pharmacies to the national health goal of vaccination coverage. So I think the technology in one way with the health system, but also in working in ways in your own national strategy, how is going in terms of community pharmacies to better communicate with their patients on a remote level. Some countries are more advanced in that than others. In our country, we have been developed for many years now, a system where patients get short messages in their smartphones directly from the pharmacy system, so they can actually get a message when it's time to get their vaccine, their next vaccine. But all that has to be also aligned with the national health guidelines and priorities, which vary from country to country.
That's really helpful, Suzete. That really links to the importance of the public health agenda, I think, on a national level, with public health campaigns in this area. Wouldn't you agree, Peter? Any further comments from you, Peter, on this?
I really liked that comment about you need to sort of tailor to the needs of the population. I'd probably also then look at when you've got an individual patient in front of you, you then need to further tailor to the individual needs of that particular person. This presentation is about older people who don't speak English, or in other countries that the predominant language is their primary language. They're less likely to speak the primary language if they've come from another country than, say, a younger person. So you may need to think about translation services or provision of more simplified language, or provision of written information in another language, which some countries are very good at producing it, and some countries don't have access to that as well. Equally, you might need larger font sizes because reading material might be more difficult. So it's about trying to understand what works, but everyone's motivated differently. There's some people who, if the government says, or the pharmacist or the doctor says I should get it, that's it, I'm getting it. There are other people who are going to want to ask a lot more questions as well. And it's really about us listening effectively and looking for sometimes the non-verbal signs from a patient on how we actually meet their needs. And it might not all be one interaction. It might be an ongoing conversation over time. I had one older person for COVID-19, and she had so many different comorbidities, but her main concern was she thought she was too unwell to receive the COVID-19 vaccine. So she isolated herself for a long period of time. And at some stage that changed, and she's got her life back now because she was able to go and have the confidence in the vaccine and the confidence that it wouldn't be harmful for her. And she's got a lot of quality of life back, which has been wonderful.
Thanks for that, Peter. And we all have older adults in our lives that we could talk to about this. So it's great to be able to have that background. Ozge, do we have one more question? We have time for maybe one more question to discuss with our guests. Is there anything in the Q&A?
We have time and we have questions. Before going into the Q&A box, we have one in the chat box, and it's about the allergies. Our guest from Serbia asks that CDC USA state that allergy to eggs is no longer contradiction for vaccination. For example, vaccination for flu, and asking how that they can change the landscape for vaccination for pharmacists. Is the kind of contradiction some specific elements is that an element for vaccination hesitancy, or how it can be overcome? I believe what's Jasna asking for.
Certainly the way that vaccines are produced has evolved with time. Certainly in Australia, the vast majority of our influenza vaccines still use egg products in their production, but we do have one brand that is available that is using a different technology. And for people that have anaphylaxis, that gives them an option. But all vaccines are produced differently. We have all these different types of vaccines, and I think our patients learn a lot more about the different types of vaccine technology during the pandemic. So people are more interested in that. I think the guidance as vaccine providers is to look at the product information relevant to the vaccine in your country for your licensed products, and to be able to provide that information with confidence to individuals. And if you're not sure, hopefully there's support services that understand the vaccines in your country you can reach out to, whether that's a colleague or whether that's a more substantive funded service.
Thank you so much. And one question in the Q&A box is about malaria. As you're the experts in vaccination, any information about vaccine against malaria?
The first malaria vaccine was approved in 2021. Not sure if I shared that in my slide. It was celebrated all over the world because it's a huge breakthrough. But of course, the policies of distributing and the most important populations to benefit from that vaccine, of course, they have to be dealt with by the WHO. I think that's the most important. There are policies and there are guidances across the world so that we can actually get vaccines reaching the right people.
And one final question is about the challenges about having national database on immunization records in countries with limited digital recording systems. Do you have any tips on how to take off with limited resources?
I think my starting point for that question, and Suzete might have some other ideas as well, but you do the best with the resources and structures and systems that you have available to you. Of course, those centralized systems weren't always available to the countries that have them now. And certainly when I was a child, we didn't have a national immunisation register in Australia. We had really excellent paper books that were provided, and your parents knew that everywhere you went, that paper book with the vaccination record for you was provided, was what you took with you everywhere. And I've spoken to some colleagues who have done some work, whether it's in different parts of Africa or Asia, and some of the stories that they have provided on how much more responsible their populations are with health records that are in paper than perhaps they are where I live in Australia. Those records never go missing. People guard those records closely, and they facilitate effective care. And as is the case in most things in vaccination, revaccination is often unlikely to be harmful. So unless revaccination is harmful, if you're really not sure if someone's had it before, in many cases, and if it's funded and available, you do have the option of revaccination as well. So and certainly I've had health professional colleagues that have been in that situation for records that weren't captured. They've gone, oh, well, I'm not sure I can get it safely again, and in a position to be able to do so. So, yeah, you do the best with what you have, and sometimes limited resources brings creativity and actually much more effective solutions.
Any final comments from you, Suzete? Or
yeah, I just wanted to, I think Peter has said pretty much, you do the best you can with the resources you have in each country, and not all countries can have national databases. But I think one thing you can do as a pharmacist, as an individual pharmacist, being myself an owner of 2 pharmacies with my family, so I know their struggles, and I know the struggles before we had a national record. So before we had the government, sharing with pharmacies the records, we created our own records. We were not waiting for the government to do that. We were not waiting for anyone. And we just created our records, not just, it's an issue of safety. You need to have a track on what vaccine and especially to be able to identify the vaccination and the vaccine batch number and all these things, and if there was an allergic reaction. We were talking about flu vaccines, of course, because with COVID the technology was other, as Peter said. But I think the most important is just, if you don't have this in your national system, just don't wait. Just start, whether it's as an individual pharmacist in your own pharmacy, you set your best practice, you're the owner, and so you can do certainly in your healthcare setting the best you can with what you have. And if you have the chance to impact at a national level in your pharmacy association, then of course you should think of creating a record for all the pharmacists. Again, not just because of ensuring that safety issues are recorded, but also to provide, to establish a basis for providing the evidence on what pharmacists are delivering in vaccination.
That's really excellent advice, Suzete and Peter. Thanks a million for this. It's about bottom-up and top-down approach to reach somehow in the middle to address some of our needs or priorities on a local level. Thank you so much to the both of you. Really, really insightful presentations. And also thank you to Dr. Jane Barratt earlier from the International Federation on Aging, who presented right at the beginning of the presentation. I've been really delighted to have you all with us. And thank you for all of the participants with all the hearts and the high fives and all the comments in the chat box as well, agreeing that they really enjoyed the presentation. I'd like to just invite everyone on the call to consider going to Brisbane, Australia for the FRP Congress. Yeah, and Peter's just going thumbs up. And if you want to meet Peter in Brisbane, maybe this is it. You'll be there. I'll just share a quick reminder for everyone on my screen, if you don't mind. Can you see my screen okay, Ozge? It's showing okay? Yeah, just wanted to let everybody know that the recording of this webinar and others can be retrieved on our events.frp.org. But join us, for those of us who will be in Australia, for the 81st FRP World Congress of Pharmacy and Pharmaceutical Sciences, which will be hosted on the 24th until the 28th of September, with the overarching theme, Pharmacy Building a Sustainable Future for Healthcare, Aligning Goals to 2030. With that, I'd like to say thank you again to Peter and Suzete and all of you on the call. Thank you, Ozge, for your support, and I wish you well. Good night to you, Peter. Good day to everybody else who's in a different time zone. And a good day to you as well, Suzete. Thank you so much. Thanks, Marianne, in the background. Thank you, FIP.
Thank you.
Thanks a million. Take care.
Bye.